Hello, and welcome to our NCI-AD Data Spotlight for February 2021. This month, we are taking a closer look at the experiences and outcomes of Black and white respondents to the NCI-AD survey, and here's why. The impact of COVID-19 brought to light and emphasized long-standing inequities faced by non-white populations. This includes access to adequate housing, the disproportionality of some types of employment by racial group, such as frontline workers, access to health care, and also access to reliable transportation. In addition, the nation experienced an awakening in terms of recognizing systemic racism and biases. The information in this spotlight is intended to help support conversations and encourage thoughtful review of the ways different races experience LTSS. Data shows Black respondents were more likely to live in their own or family home than white respondents. This could be indicative of the impact that cultural norms can have on racial groups when it comes to aging. Data also show Black respondents were twice as likely to live in a zip code where the median income was $40,000 annually or less, 60% versus 30%. The survey asks a series of questions about direct care staff. Half of Black respondents shared their main support, either paid or unpaid, is a family member versus 30% of white respondents. Compared to white respondents, Black respondents were more likely to report that staff treat them with respect, more likely to report that staff show up and leave on time, and more likely to report they can change staff if they want to. Regarding choice and control, 71% of Black respondents reported they could choose when and how often to get services, compared to 66% of white respondents. The NCI-AD survey also asks about preventive care and mental health. Black respondents were more likely to report being in fair or poor health. Response options also included excellent, very good, or good health. Black respondents were less likely to have had the flu vaccine, 78% versus 67%, and also less likely to have received mental health services. NCI-AD data comes directly from older adults and people with physical disabilities and provides valuable insight for state decision makers and others. Analysis included roughly 8,400 white respondents and 3,100 Black respondents across 16 states who took part in the 1819 NCI-AD survey. To learn more about NCI-AD, check out nciad.org or email us at ayoung@advancingstates.org and sgiordano@hsri.org.